Hi, I'm going to be presenting postural hypertension featuring Ina Glozman, Kayla Keokham, and myself, Nicole Figueroa. So, what is postural hypotension? Postural hypotension, which is also known as orthostatic hypotension, is when there's a sudden drop in blood pressure caused by a person's sudden change in posture. For example, a person may go from a seated position in a dental chair to a standing position quickly, which the body is not able to adjust to. When there is a drop in blood pressure, there is less blood that goes to the organs and muscles. Some of the main causes of postural hypotension are dehydration, weather, medications like beta blockers and antidepressants, age, anemia, and immobility. Some diseases are linked to postural hypotension as well. These are listed as neurogenic and non-neurogenic diseases. The neurogenic diseases would be Parkinson's, multiple systems atrophy, and dementia, as the non-neurogenic diseases would be diabetes, cardiovascular disease, and impaired cardiac output, such as arrhythmia and aortic stenosis. Some symptoms of postural hypotension could be dizziness or lightheadedness, syncope, which is fainting or falling, headaches, blurriness or tunnel vision, feeling pressure across back of shoulders or neck, nausea, feeling of being hot or clammy, weakness or fatigue, palpitations, or dyspnea, which is shortness of breath, although some patients could also not show any symptoms at all. In many cases, evaluating the severity of postural hypotension is to seek out the underlying causes. It is critical for the doctor to conduct a physical examination to help diagnose the condition of the patient. There are a list of tests the doctor might use to find answers about the patient's condition. The doctor will probably start with a blood and blood pressure test. These tests will provide information about the overall health of the patient, including low blood sugar, which is hypoglycemia, and a low red blood cell levels, which is anemia, both of which can cause low blood pressure. Next, an electrocardiogram or an echocardiogram might be conducted to detect problems in the heart rhythm or the heart structure. The doctor might conduct a stress test to see how the heart performs under stress. One of the most important tests is the tilt table test. A tilt table test evaluates how the body reacts to changes in position. The patient lies on a table that tilts to rise the upper part of the body, which simulates the movement from a horizontal to a standing position. The patient's blood pressure is taken frequently as the table is tilted. Lastly, the Valsalva maneuver might be administered. This non-invasive test checks the functionality of the autonomic nervous system by analyzing the heart rate and blood pressure after several cycles of deep breathing. All of these tests are imperative in finding the underlying causes and to be able to select the correct treatment for this condition. Treatment for postural hypertension can vary. Some of the most common treatments are compression stockings, lifestyle changes, and medication. Compression stockings and garments are used to reduce the pooling of blood in your legs and help to reduce the symptoms of postural hypertension. Another treatment used is lifestyle changes. Some changes that your doctor may suggest include drinking more water, drinking less to no alcohol, raising the head of your bed, and standing up slowly. Lastly, your doctor may suggest one or more medications. Some of the medications that can help with postural hypertension are fludrocortisone, droxidropa, and pyridostigmine. These medications are used to help increase the amount of fluid in your blood, which raises blood pressure. There are a few steps that dental professionals can take to prevent patients from experiencing postural hypotension in the office. The first step is for a medical history questionnaire to be completed by the patient, which should include any medical condition and medications taken on a regular basis. The second step is to talk with the patient about their medical history and ask specific questions regarding the information listed on the questionnaire. The third step is taking vital signs of the patient. It is suggested that baseline vitals should be recorded on all new patients as routine part of the pre-treatment evaluation. In the event that a patient does have an emergency involving postural hypotension in the dental office, there are a set of procedures that the staff will have to have in place. The first step is to place the patient in the supine position for 5 to 10 minutes. Next, vital signs will need to be taken. The staff will need to provide oxygen as needed. Next, the patient will need to slowly sit up for 2 minutes, at which time the staff will need to reevaluate vitals. Then the patient will need to slowly stand up for another 2 minutes. Vitals will need to be reevaluated again. If the patient deteriorates, call 911 immediately and continue to monitor vital signs. If the patient becomes unresponsive, administer CPR. When medical emergencies happen in the dental office, it creates a hindrance in dental care. With a dental staff that has been properly educated on what to look for and what to do in an emergency, the situation will be handled quickly and effectively.